physical activity significantly reduced the stress, anxiety, depression in the majority of the population. If you are stressed out, we might have the cure for you.
Well, I don't love the word cure.
If you are stressed out, we might have something that could possibly help you a little bit.
Okay.
Is that a little better?
Hedging your bets a little bit. I like it.
Welcome to Talking with Docs. I'm Dr. Paul Zalzal.
I'm Dr. Brad Weenie.
Journal Club.
Journal Club.
I love Journal Club.
Okay. Today we're talking about a really important topic. Whether or not exercise is useful for anxiety, depression, and generalized stress over conventional therapies like medication and psychotherapy.
Okay, and the article is called Effectiveness of Physical Activity Interventions for Improving Depression, Anxiety, and Distress, an overview of systematic reviews. This is open access, so anybody can access this. If you can read words, put letters together and sound out words, you can read this article and get the results yourself.
You had to tell them where it's from.
I'm going to tell them.
Okay.
It's from the British Journal of Sports Medicine. And what do we always say?
If it's British, you know it's good.
It's good. It's always good. Because you say chip, we say crisp.
Okay, we get it.
You say French fry, we say chip.
Yeah.
You say football, we say soccer.
Okay.
You say soccer, we say rubbish.
Yeah, that's what that was.
So this was done this year, published this year.
Okay.
And what these reviewers did is they reviewed a bunch of review articles. So they took systematic reviews. So systematic review is where the researcher will take a bunch of randomized controlled trials and pool all the patients together to have a more powered study to try and prove a point.
Right.
So then an umbrella review, which is this type of reviews, where these reviewers take a bunch of systematic reviews and pool all those patients and study subjects together to get an even bigger number.
The thought being that if there's a really small benefit, this amplifies it so that you can actually find it. So this is a study in adults.
Adults.
Okay.
And they looked at healthy people. They looked at people without other sort of comorbidities.
Yep.
They looked at people who have stress, anxiety, depression due to chronic illness or just in generalized.
All types of populations. How do they define exercise? So was it like going to the gym for 20 minutes, 30 minutes on the treadmill, cycling on a stationary bike?
Bob.
Okay.
It's much more generalized than that. This is the
Appreciate this
definition
in a
of
British accent, please.
physical activity. Any bodily movement produced by the contraction of skeletal muscle that results in a substantial increase in caloric requirements over resting energy expenditure.
Leave a comment if you're British and you found Paul's accent offensive.
Leave your comment in a British accent.
We actually have a bit of a presence in the UK. About 8% of our views come from the United Kingdom.
Thank you.
Shout out across the pond.
So that's what they defined as physical activity, okay? You don't need a gym to do it. Getting up, walking briskly, that kind of stuff.
Okay, and they compared it to medication and behavior modification or psychotherapy.
Yeah, so this is like alongside, in addition to other therapies, just adding this.
Okay, so what did they find?
They found that yes, indeed, physical activity significantly reduced the stress, anxiety, depression in the majority of the population.
Okay.
With or without chronic illness. I mean, they looked at people with postpartum depression and had a good effect on that. They looked at people with chronic disease like HIV and had an effect on that as well. And they also found that the intensity of the physical activity was also related with how much benefit you get.
Okay, and I think what's important to recognize is the world talks a lot about anxiety and depression right now, and some of the more common terms that are used are like small T trauma and big T trauma. So like small T trauma is like your day-to-day stuff that causes you anxiety and depression. But big T trauma is like assault or accidents or that kind of stuff or significant losses. Those are kind of things that you're not going to be able to exercise your way out. Not that it's not going to be important, but definitely that's something you need to talk to someone about because there's a lot of help available for you. So please talk to your family doctor or a professional and get help with that because there are strategies that you can use to address some of this stuff that is not, we don't want to minimize it. That's all. Big T trauma is more important.
Yeah, absolutely.
Okay.
You're going to need help. And even if you are on medication for your mood, don't stop it based on this. Obviously, this is just something that you can add to what you're doing that might help along with your mood disorder.
And what did it say about the difference between like North American strategies versus some of the other strategies?
Yeah, they did comment on that. It's an interesting note that in North America, the first line treatment for these type of mood disorders is pharmacotherapy and psychotherapy.
Yeah.
Whereas in Australia, for example, the first line treatment would be a prescription of physical activity.
Right.
The challenge is it's hard to prescribe physical activity. With a medication, you can prescribe the medication, go take this, you can tell the person's taking it or not.
You're like, go run.
Yeah, but basically we should be doing that. Here's your exercise, maybe keep a journal, keep a log or something.
Yeah.
But it's hard to prescribe. It's kind of now social prescribing. We're basically trying to prescribe lifestyle changes to help. And
but it's cheap. You know what I mean? You can do it anywhere essentially, and anyone can do it. Even just like we've always said, just do something. Get up, get outside, experience your environment, be in the moment, be mindful. We talked about that in some of our other videos.
Be physical.
Be physical.
Just like, who said it?
Olivia Newton-John, I think. Let's get physical.
physical.
For all you boomers out there that like Olivia Newton-John.
I like.
Yeah. And the Australians do too. I believe she's Australian.
She was.
If you like this video, please like it, subscribe to our channel, and please embrace some physical activity. Leave some strategies that you've used for exercise as ways to reduce your anxiety, depression.
And remember, you are in charge of your own health.
We'll see you next time.
Did you like Grease?
I did like Grease.
I love that movie.
Yeah.